Communications. Communications is an expression of many different types of forms. It could be words, it could be symbols, it could be in writing, to say the least. But the essentials of any communication is the message. The sender, is it the spoken word that they're delivering? Is it a written word, as in writing? Are they delivering sign language? Is the message being delivered through a cell phone? Is it being delivered through touch, through braille? Is the message being delivered in a foreign language? Are they delivering the message through symbols, or is the message being delivered through pictures? One thing for sure, whatever that message may be, it must be received. There are many ways that indicate that a message, in fact, has been received. We use many methods of verification to establish whether the message has been received. We may have the person to give a statement to answer a particular question. That question could be a direct question in which you could easily respond to a yes or no. Are you male or female? If the answer is female, you would give that one answer. So we can actually deliver a message in such a way as to end with a close-end question. But one thing, we must interpret what that message has said. Sometimes a message is not interpreted from the sender. Sometimes we have to use symbols to reinforce that message, or we may have to even use a picture. In healthcare, especially in healthcare, documentation is extremely important. There are guidelines on the proper way to document your observations or your findings. Those rules are put there for the purpose of not only the person that is writing the message or delivering the message, but for those that must receive that message and possibly act on the message. There are many examples of such a message. For example, if you write a temperature and you wrote down that the person's or the client or resident or patient's temperature was 101 degrees Fahrenheit, and you made an error and you really wanted to write that the temperature was 100.1 degrees Fahrenheit. That documentation could result in different actions based on what was written down. So there are rules for governing communications. Your charting on the medical record is, first of all, is the record complete? Have you charted the information after you completed the task, or did you chart the information before you completed the task? There are some pitfalls for charting the information before you complete the task. I'll give you one example. For example, if you said that you had assisted a patient or resident with a bath at 10 o'clock and it was not yet 10 a.m., then something could have happened to the patient at 10 a.m. They could have vomited, they could have fainted, they could have even coded, and you would have incorrectly charted an action in which you had not performed. So therefore the rule is chart after completing a task. Another rule governing communications in healthcare is maintaining privacy. You have the written record, you have the medical automation record, but whatever method is used at your facility, you must maintain that privacy. If you're using a computer screen, you don't want to show the computer screen to your visitors that are coming in, because you would violate the person's privacy. If you're logging on a computer, you don't want to forget to log off, because someone else could obtain the private information on your client. If you have a medical hard copy record and you happen to become very busy and you left that hard copy record out, then anyone could look at that sensitive information on the patient. Also, guard against the oral conversation. If you're on an elevator or in a break room and someone comes in that you're not discussing that particular information on, they could also gain that information. So you would be violating the person's privacy. Medical records is a very private information, and is only privy to those persons that need the record to render the care. So therefore, we don't want to leave the record with the folder open up so that anybody stopping by could just peep and find out some information on the patient. The electronic medical records are no different. The electronic medical record is a tool. It too can be compromised. You mustn't let a coworker log on and write your note. Remember, it is what you did for the client or the resident that needs to be documented. Time is important. We note the time that we complete a particular task so that others will view that information. There are usually 3 shifts on the inpatient side, and other persons need that information in order to make decisions on what to do or to transfer that information to a different shift. Another rule for governing communication: observe privacy. There has been instituted for some time the Privacy Act of 1970, and every time you enter the health field, the service representative, medical service representative, will give you this form, and whether it's in the computer or on a hard copy, to sign, because we are now obtaining information that may have to be used by more than just the nurse, the doctor, and so forth. The next rule in communication: observe the Health Insurance Portability and Accountability Act that really was started in 1996. It was called the HIPAA. This act is very important because we transport information by fax machine or by computer, and even to another consultant. Telephone rules. Phone rules. Nursing on the inpatient side. And this includes nursing homes, assisted living, acute care hospitals, tertiary or consulting hospitals, that are specialty hospitals that take care of certain types of care. The privacy of the patient information is very important. How do you answer the phone? If you use the fax machine, are you sure that that is a secured fax in which the medical reports will not be compromised? If it's the telephone that you are answering, it's telephone etiquette in a client's home or a private home that must be observed. You cannot answer the phone, "This is Mrs. Jackson's residence," because you just violated her privacy. The proper way would be to say hello and then receive the information. Remember, Miss Jackson may not even want to talk to the person. It could be a telemarketer, but it could be somebody that's plain nosy trying to get into her business. Another phone rule: if a physician calls to ask or to send orders to be carried out on a resident or patient, as a certified nursing assistant, you do not take telephone orders and deliver them for action. The proper thing is to get the nurse, get the doctor's name, and get the nurse to take that telephone order. For example, suppose the doctor said discontinue a particular IV, or to insert a catheter in a patient, or to discontinue a medication. You don't take those kind of orders. That is not in your scope of practice. So you would take the doctor's name, phone number, get the nurse to take that order as part of your telephone etiquette. Medical records documentation. The documentation, first of all, needs to be legible. If the documentation is not legible, then the other persons that will need that information to incorporate it in their plans for the care, medical care for the patient, will be compromised. Once you have written your note, you cannot erase the note. We cannot use erasable ink pens. That's not how we correct a written error. For example, if you wrote that you took Mr. Larnell to the lobby awaiting transportation to go to receive further medical studies, and you made a mistake and you wrote it on the wrong record, then the way you would correct it would be with a line and with the ink pen, not erasable, and then write the correct note and the reason that you recorded on the wrong record. And you would have to write your name or your initials with that particular time when you entered the corrected note. So correction for errors is very important. If it's in the computer and you made error in the computer, depending on the software, how you would correct that error. If it is a nursing note, a narrative note, then you would again put the time and the date, and the computer will record when you made that correction.